Good evening, everyone, and welcome to today's session. Roshan, Ibrahim Syed, Khanna, Arnold, Praveen, Lovepreet, Pankaj, Krishnadas, and many more who are all online. Sorry, today I'm a bit late. Every Sankranti, happy Sankranti to all. We are not this fortunate today. There is a very good breeze in the Hyderabad. So on the terrace with a bunch of kids, the future of the next generation. So I was flying kites. खेलते खेलते time भूल गया. So suddenly I remembered there are many more kids across the country who are waiting, with whom I need to fly the anatomy kites. I hope you all had been flying kites today's delightful evening, and let's make the great beginning. So doctor, what are the branches of the internal iliac artery? Keep punching the answers, doctor. As I once more tell you all that what is our game plan? I keep reminding you with a sole intention to keep the focus intact. We started on January 6th. Those who are repeating after the recent entrance exam, I wish you are able to overcome that morning phase, not morning of the NEET PG 2020. It is over. The future is AIIMS May, PGI May, and we should aspire to be the residents in Ansari Nagar in the June in the All India Institute of Medical Sciences. So that should be the goal. So from January 6th to June 30, we are having every day 2 hours of live broadcast, and in the foreign medical graduate exam, FMGE, MCI screening test, there are 10,000 questions in 19 subjects. We are going to topic-wise classify them and then do a quick revision. Then we will say tata goodbye to all our FMGE MCI screening classmates. And starting from July 1st to November 30, we are having around 6,000 questions in past 15 years of PGI Chandigarh Question Bank. Totally 30 exams, excellent questions. So they also topic wise we will organize and do a revision of the PGI Question Bank. इतने में हमको December 1st नोटिफिकेशन आएगा नेक्स्ट NEET PG का, December 1st to January 4th. Every day we will have a grand test discussion, and try to consolidate our preparation. Right? That's the deal. Meanwhile, every Saturday we will have a subject test and discussion. Every Sunday we will have a full-scale grand test and discussion from January to November. So that is the deal. I wish you all will stick to this, and you need not run here and there for that class, this coaching, that face-to-face class and all that. Comfortably sit at your own home. If you have a smartphone, laptop, YouTube, I'm all yours. So let us journey together to crack the exam. So doctor, these are all the branches of the internal iliac artery except ovarian artery, which is the branch of the aorta, and yesterday only we discussed what are the branches of the anterior trunk and posterior. Slip, SLIP, posterior 3 vessels, right? Whereas all the remaining come from the anterior division. So One more favorite question of the examiner is, what are the branches of the femoral artery? There are three superficial branches: superficial epigastric, superficial external pudendal, superficial circumflex iliac. They're all the branches of the femoral artery in the femoral triangle. Then there are three deep branches of the femoral artery. Profunda. Profunda means deep. Profunda femoris, deep external pudendal, and the various muscular branches is what you should remember. So the lateral sacral artery, iliolumbar artery, they're all the part of what? Posterior division of the internal iliac artery. They are arising from the, you can see, this is arising from posterior division of the internal iliac. So you have to be very clear on this fact, because examiner is going to test this very emphatically. Which is not supplied by superior mesenteric artery. You know very well, ascending colon, appendix, and jejunum up to right side 2/3 of the transverse colon. They're all superior. After that, it is all hindgut, inferior mesenteric artery that supplies the descending colon is what you need to remember. और एक बार बोलो डॉक्टर, दिल लगा के बोलो, superior mesenteric artery branches, inferior pancreatico-duodenal artery, jejunal and ileal arteries, middle colic artery, right colic artery, iliocolic artery. They're all the branches of the superior mesenteric artery. Is what you have to be very sure about. So you can see the middle colic artery, right colic artery, iliocolic artery, all of them arising from the superior mesenteric. Whereas left colic, sigmoid artery, they're all the branches of the inferior mesenteric artery, and together they form the marginal artery is what you should remember. Now doctor, uterine artery is a branch of, come on, punch your answers doctor. Question number 244. Yes, punch your emphatic answer. Uterine artery is a branch of. Who is going to give me the correct answer? Praveen is proposing internal iliac artery. Okay. Ritvik Kanumuri is proposing external iliac. Most of you are on internal iliac. Absolutely. So doctor, this is aorta. From that comes the renal artery. From that directly comes the ovarian artery if it is female, testicular if it is male. Then it becomes common iliac artery. And this is the internal iliac artery. From the internal iliac artery, क्या निकल रहा है? Uterine artery. Uterine artery is arising from the internal iliac is what you should remember. Okay, now this is a little bigger picture. This is aorta, inferior vena cava, renal artery, ovarian artery, common iliac artery. Then the ovarian artery is directly coming from the aorta. And then uterine artery is coming from the internal iliac. Both of them typically form utero-ovarian communication network. That is what they together will merge to form a communication arterial network is what you need to remember. Now doctor, short gastric arteries are a branch of. So a lot of students requested to provide the notes, right? So that is the reason what I have done is I'm a completely e-guy. I don't believe in print, right? Print or face-to-face classes, both dur ki baat. So There are about 1,000 high-yield facts, whether it is FMGE, AIIMS, All India, PGI, NEET PG, anyway, there are 1,000 high-yield facts that you are supposed to know by heart in anatomy before you go to exam. So these 1,000 high-yield facts, I am creating a ebook. Just it is in the process. I am creating a ebook and I am putting it up in Amazon and Google Play Books. You can be able to buy it. It's very cheap. It comes for about 200 bucks, right? So for about 200 rupees, a ebook in Amazon and in Google Play Books, so that you can be able to buy and download into either your Kindle app or Kindle or in the Google Play Books. You can be able to do the revision. So I'm going to give you all each of our notes of each subject converted into a ebook and made it available for you to quickly download and then buy, which will be able to supplement these live lectures. So that is the idea. Short gastric arteries are the branches of splenic artery. So you know very well that the celiac trunk mainly has 3 branches. What are they? Left gastric artery, splenic artery, common hepatic artery. Left gastric artery supplies the cardia of the stomach and distal esophagus. Splenic artery will be giving rise to 2 main branches. What are they? Left gastroepiploic artery and short gastric arteries. Lot of short gastric arteries and left gastroepiploic artery. Then you have common hepatic artery. It has 2 major branches, a right gastric artery and the gastroduodenal artery. And the gastroduodenal artery will give rise to, gastroduodenal artery will be giving rise to the left it will be giving rise to right gastroepiploic artery. So this is a favorite question of the examiner, doctor. Please don't forget. Right gastroepiploic artery comes from gastroduodenal artery, comes from common hepatic artery, which is the branch of celiac trunk. Barabar? Then left gastroepiploic artery is a branch of the splenic artery, is what you have to ultimately remember. Now doctor, ovarian artery is a branch of abdominal part of aorta. So if you look at the blood supply of uterus, there is a uterine artery which will be coming from the anterior branch of the internal iliac artery, which will be giving rise to arcuate arteries, radial arteries, finally spiral arteries. Then there are also ovarian arteries coming from the aorta, which also supply the uterus. And uterus ka lymph drainage, where will it go to, doctor? Internal iliac group of lymph nodes. It will be going to. That's what you should remember. Then what is the blood supply of ovary? Favorite question of examiner. The ovarian arteries arise from the abdominal aorta. Ovarian veins drain into pampiniform plexus of veins. Where are they located? Broad ligament of the ovary. Okay. Then the veins of this pampiniform plexus will all merge together. They form a singular ovarian vein, and typically the ovarian vein on the right side will go into inferior vena cava, left side will go into left renal vein. That is what you need to remember. Now what are the branches of the posterior division of the internal iliac artery? Slip. You should not forget. S for superior gluteal, L for lateral sacral, I for iliolumbar. You go to America to write USMLE, or you go to Philippines to write national licensing exam. You know Philippines में क्या होता है MBBS पास होने के बाद? See, today we are all crying about next exam. But Philippines, after you pass MBBS exam, you need to take a national level exit exam. It is there since times immemorial in Philippines. अभी हम भारत में करने का सोच रहे हैं. So they take 2 hours anatomy, 2 hours physiology. Totally they take around 12 papers, MCQ papers. Unless the people clear this, they will not be permitted to take the licensing exams. And people will torn their shirt and run in the streets when they clear the exam. So that is the challenge. So even their question bank also, if you take the last 15 years of the Philippines exam also in anatomy, these are the only hot issues for the examiner. Any medical student in the world, his brain is being destroyed and wasted in mugging these facts for cracking the exams, unfortunately, right? So cramming is inevitable part, but we should learn, love, and tricky way to remember to finally clear the exams. That's the only thing. So exams are not for acquiring knowledge. Acquiring knowledge is throughout life we do. But in exams, we need to be sure what examiner want, what I can give. Am I finishing that high yield content or not? Most important of it. So now, branches of the anterior division of the internal iliac artery, once more foreign medical graduate exam का favorite question है. So you should remember superior vesicle, inferior vesicle, they are all from the anterior division, but superior gluteal comes from the slip posterior division. That is what you need to basically remember. Okay, doc? Now, where will you feel the pulsations of the femoral vessels? It is at the mid-inguinal point where you will be feeling the pulsations. What are the branches of the femoral artery? अभी discuss किया ना? One artery, one vein, one nerve, one ligament, one bone. Out of your 20 MCQs that are going to come in the NEET PG or FMGE or any exam, you can be very sure. And the nerve can be one of the ulnar, radial, median, axillary, musculocutaneous. From that, one question is going to come. So that's the reason, doctor. Strategy, focus. Now, what are the branches of the femoral artery? Superior external pudendal artery, deep external pudendal artery, profunda femoris artery. They're all the branches of the femoral artery. Now, it is not a muscular artery. Aorta is not muscular artery. Femoral artery, popliteal artery, splenic artery, they're all called as muscular arteries. Now, doctor, muscles of the lower limb. Good to see Ravi Kamble, Krishna Das, Arnold, Ibrahim Syed. These are our new classmate. Welcome, Ibrahim. From which part of the country are you from? In which part of the country you are from? So, doctor, on 26th January, Republic Day, I am there in Bangalore, 10 a.m. to 5 p.m., 10 a.m. to 1 p.m., 2 p.m. to 5 p.m., 6 hours. We are having a marathon general medicine session for the final year. That is those who finish their ENT optal SPM, no? Part 1. For them who are entering into part 2, right? So we are having a live session in Jayanagar, Bangalore. So please tell your juniors to have an opportunity to have a face-to-face live class and a quick revision in 5 Sundays. I am going to revise the entire medicine from a exam perspective to go for the university exam, clinical cases, common viva questions, etc. Of course, that is also, theory is always the basis for entrance exam also. but it is a theory-based review. If any of you are in Bangalore, please hang out. I would be more than happy to meet you. So I will quickly tell you where is the address also in Bangalore. In Jayanagar, I'll post in the WhatsApp group also which address it is. We have a face-to-face class, and in about 5 Sundays, 30 hours, we do a complete revision of most important topics in the university exam, all 5 Sundays in Bangalore. So on 26th January onwards, it will be starting, right? Now, Delhi कब आएंगे आप? जब बुलाएंगे आप तब आएंगे. 24th I am in Dehradun. In the Doon Medical College, I am delivering a session called Learn ECG in 3 hours. So if you are from Dehradun, please join in the Doon Medical College, Government Doon Medical College, to be part of the communion, right? Now, muscles of the lower limb. Which muscle is an everter? Which muscle is inverter of the foot? Peroneus longus is a everter. So doctor, let us get very sure on this very important topic, leg. The leg and the muscles of the leg. Leg में एक anterior compartment, lateral compartment, posterior compartment which is superficial and deep. So you can see this is the anterior compartment, you have a lateral compartment, this is the deep posterior compartment, and this is the superficial posterior compartment of the leg is what you should remember. Now this is the patella, tibia, fibula, and here you have the anterior compartment. This is the lateral compartment, and these are the deep and superficial posterior compartments. This is how the leg is being compartmentalized. So now doctor, the lateral compartment is supplied by superficial peroneal nerve. Then this is the deep posterior compartment, this is the superficial posterior compartment. This is the tibia, which is anteriorly located. Between tibia and fibula, here you have the anterior compartment is what you should remember. Right? Now, this is the tibia. You can see tibialis anterior muscle. This is extensor digitorum hallucis. Then here you can see the deep peroneal and anterior tibial nerve. This is the peroneus longus and brevis. Then here you have the fibula. Then in the posterior compartment you are having gastrocnemius and soleus muscle. This major muscle is soleus muscle. And this is the tibial nerve is what you are able to see. So some of you are going to be good to see Bhavna. Welcome. Now, some of you are going to become top radiologists. MRI. If you want to be very sure on MRI, you should be very sure on this muscular cross section. So typically, anterior compartment dorsiflexes the ankle. Dorsiflexion means, suppose this is the ground, sole. If the foot is looking up is dorsiflexion. If the sole, this is the ground, sole raised and foot is going down is plantiflexion. So dorsiflexion of the ankle, extension of the toes, that is the function of the anterior compartment. Anterior compartment contain anterior tibial nerve, anterior tibial artery, The blood supply is anterior tibial artery, and the innervation comes from the deep peroneal nerve, which is called fibular nerve. Is the one which supplies the muscles of the anterior compartment. So what are all the muscles of the anterior compartment which are supplied by the deep peroneal nerve, doctor? Tibialis anterior, extensor hallucis longus, extensor digitorum longus, and peroneus tertius is what you need to remember. Very good. Ibrahim Syed from Narsarawpet, Guntur. Excellent. My first batch of students way back 20 years back in 2000 when I was 1999 when I was conducting class, Usmania Medical College, Gandhi Medical College, Deccan Medical College and Guntur Medical College, right? So one of my students, I cannot forget, Dr. Satyavati. Past 2 years she was awfully failing in an entrance exam, very borderline. She made it to 7th rank. So that was a great leap in those days, right? So I'm quite attached to the students, and I will never forget in my lifetime, even few decades past, because almost every day we are all meeting. So unknowingly we develop a bonding. So how can I forget? So tibialis anterior, extensor digitorum longus, hallucis and peroneus tertius. Now 1-2 comments about each of these muscles. Tibialis anterior. You are able to see tibialis anterior here, right, doctor? So the origin is from the lateral condyle of the tibia and the lateral, upper lateral surface of the tibia, interosseous membrane, and it inserts onto the base of the first metatarsal and medial cuneiform, and it is supplied by deep peroneal nerve, L4, L5, ankle dorsiflexion and forefoot inversion. That is the function of the tibialis anterior. Extensor digitorum longus is what you are seeing. It is also arising from the lateral condyle of the tibia, antesurface of the fibula, interosseous membrane, inserts into the base. Typically it inserts into the base of the middle phalanx and deep fibular nerve, extension of toes and dorsiflexion. Dorsiflexion of the ankle is the function of extensor digitorum longus. Extensor hallucis longus, it arises from the middle of the half of the anterior fibula, quite an extensive origin. And big toes distal phalanx. Big toes distal phalanx is where hallucis longus inserts. Deep fibular nerve extends the great toe, dorsiflex the ankle is what you need to remember. Peroneus tertius. Its origin is from the distal 1/3 of the anterior fibula, interosseous membrane, and it inserts into the dorsum of the shaft of the 5th metatarsal. 5th metatarsal is like your little finger in the foot. So it leads to forefoot eversion and a weak ankle dorsiflexion because it's an anterior compartment nerve. Lateral compartment muscles are all evertus, and superficial peroneal nerve is the one which supplies them. There are no major arteries in the lateral compartment, and the branches arise from the peroneal artery, which is the branch of the posterior tibial artery, and nerve supply is superficial peroneal nerve. What are the two muscles in the lateral compartment? Lateral aspect towards your little toe, lateral, right? Now, peroneus longus and peroneus brevis. So, peroneus longus, from where it arises. Upper 2/3 of the lateral surface of the fibula and it inserts into the inferolateral. It will cross like this. Inferolateral surface of the medial cuneiform. Medial cuneiform. It goes under the foot and supplies the medial cuneiform. And typically it leads to eversion of the foot, outward movement, and ankle plantar flexion. Plantar flexion, because it is a lateral compartment. Dorsiflexion is by anterior compartment. That is what you need to remember. Then peroneus brevis. It arises from the lateral, the lower 2/3 of the lateral fibula. It also will course behind the lateral malleolus, underneath the fibular trochlea. You know, behind the medial malleolus, what are running? Tom, Dick and Nervous Harry. You remember that mnemonic no, under the flexor retinaculum, right? You remember, right? Then it inserts onto the fifth metatarsal tuberosity. It leads to forefoot eversion and ankle flexion because of lateral compartment. So the point of interest here is, what is the tricky point of exam? If you take peroneus longus, peroneus brevis, they are lateral compartment, they are everters and plantiflexus. Whereas peroneus tertius is arising from anterior compartment. That is what you need to remember. Okay. Then finally, we have the posterior compartment containing plantar flexor muscles. Now, the short saphenous vein, medial cutaneous nerve of calf, sural nerve, peroneal communicating branch of the common peroneal nerve. They are all the part of the superficial. There are two in posterior, superficial and deep posterior compartment. So what is the function of posterior compartment? Plantiflexors, powerful plantiflexors are all arising from the posterior compartment is what you need to remember. Doctor, 2 minutes I will be out of the broadcast. The idea is next couple of hours of our discussion. After the discussion is over, we are going to delete from YouTube and upload it into onlinembbs.com video library along with 3000 video lectures. Only this part remains in the YouTube. Once more, to invite everybody and tell everybody, as like an advertisement, who said we are not commercial? We are commercial, definitely. So I request all of you to subscribe to the onlinembbs.com video library for a throwaway price, whatever price that you can afford. And you have these daily live online sessions, around 500 lectures, 500 hours of interactive content across the year, and already there are 3000 video lectures in onlinembbs.com, 2 lakh PowerPoint slides of notes, 30,000 MCQs topic wise classified and discussed, and around 200 grand tests and discussions, everything available in the onlinembbs.com. So please stay online. Within 2 minutes I restart the broadcast. Just go back to the YouTube's homepage of the youtube.com online MBBS. Once more you will see live. Once you click it, you will join. So another 2 minutes I will restart the session. Yeah.